tests available, and labs are working around the clock to process results as quickly as possible. For more on all of this, I'm joined live by Michelle Hoad, who's the CEO of the Medical Laboratory Professionals Association of Ontario. Michelle, good afternoon. Thanks for joining us.
Thanks for having me.
Now, you tweeted this yesterday. You said, let's stop calling them rapid tests. What did you mean by that?
I think based on our experience that we've had for the last 4 months, the definition of rapid tests, many of us had interpreted that as soon as you got a test, you would know immediately if you had COVID or not. That is not at all how these tests work. And so I think it's important that the public understands that these are not rapid tests. They are tests that give us results quickly, but to get those results requires processing and data processing, and then the receiving of that information. So it takes a little bit of time.
Right. It's not like a pregnancy test where you do your thing and then you can see it in a few minutes yourself, correct?
That's exactly right. That's not at all how it works.
All right.
Each instrument is a little bit different. Yeah.
And how many of these quick result tests are available now? And are some more accurate than others?
So each machine actually has a different specificity and is able to provide a result. They are all over the province right now. From what I understand, the last number that was reported was over 800,000 have actually been used. So 800,000 of those rapid tests are actually out there and have been used. But again, we have to remember, this is just a tool that we can use. It is a one moment in time point to tell us, do you have enough viral load in your system that it's going to show up as positive? A lot of people, I think, are considering that, you know what, I'm just going to get a rapid test done and I'll know pretty quickly if I've got COVID. You might not be carrying a lot of that virus in you for it to show up. So we need to tread very carefully on how we're using these.
So the PCR tests are still the most accurate form of testing that we have in terms of gauging if someone has COVID-19 or not. But where would you say these quick result tests are more suited to? Like, what scenarios are we talking about?
So great question. So they are perfect in environments where there is a potential breakout. So our long-term care homes, even our university settings, our school settings, if we want to test a population very quickly, we will get that result quickly. But again, surrounding that, what does that look like? It means there needs to be an instrument, potentially in a long-term care home. There needs to be a nurse or a healthcare worker that needs to swab. Or if it's a school, then those results need to get loaded to our main database. So they're good if we actually have the resources to support it in those settings.
And I want to ask you about Dr. David Williams saying that he wants to implement a rapid antigen testing system for Southern Ontario schools. We have a deadline of February 10th for Toronto, York, Peel, and Hamilton. What is that going to look like? And do you think that this is realistically possible?
It's a really great question. So if we think, what should that look like? There needs to potentially be a healthcare worker on site, or the test needs to be different. We're not quite certain what the plans are, but I think we need to remind ourselves that it will require a lot of effort from a lot of different groups. You know, the one example I keep thinking about is our long-term care homes and how stressed they currently are. Now we're expecting, are we going to put a nurse in that setting? Are we going to put a healthcare worker in that setting? Are they going to swab? How does the results flow out? There's a lot of logistics of that. It's easy for us to say, let's grab a machine and let's put it there. It doesn't work that way. There's a lot of moving parts that need to get finalized and confirmed.
Okay, thank you so much for your time this afternoon, Michelle. I hope to speak to you soon.
Have a good day.
You too. And that was